Welcome back, everybody, to another exciting session of the NASM Systematizing the One Health Approach in Preparedness and Response Efforts for Infectious Disease Outbreaks. We had a fabulous morning already on the two panel discussions, and now we're going to move to two exciting plenary speakers, and then we'll have a question and answer, and then a summary of day two. And so without further ado, I would like to introduce our two speakers. We're going to hear from Dr. Lonnie King, who has served as dean for 3 colleges, most recently as interim dean of the College of Food, Agriculture, and Environmental Sciences at The Ohio State University, and VP for Agriculture, who's also dean of the College of Veterinary Medicine at The Ohio State University, and then also the director of the National Center for Zoonotic Vector-Borne and Enteric Diseases at the CDC. And so he has from a long vision of combining different sectors, and he's going to be speaking to us next. I also want to take the moment to introduce our second plenary speaker, about Trina Smith, who comes to us from UC Davis as a professor of infectious disease epidemiology in the School of Veterinary Medicine, where she co-leads the USAID One Health Workforce Next Generation Project, and also co-leads the multi-campus Planetary Health Center of Expertise within the UC Global Health Institute, and is associate director at the UC Davis One Health Institute. And so what we're going to hear first is from Lonnie King, who is going to speak to us, and the title of his talk is One Health Workforce, Reconciling Competencies with Opportunities. Thank you, Lonnie.
Great, thanks very much, Dr. Harris, and thanks to the forum for the kind invitation to join you. Next slide. So the objectives for this short session are to review recent progress in building a One Health workforce, to explore, secondly, the most pressing needs remaining in education and the gap linking these needs with practical field applications, and thirdly, to recommend transformative changes, and I'll underline transformative, to address these issues that can be done or accomplished right now. By the way, the title of this involves reconciling competencies with opportunities, is a quote that comes from Admiral Thad Allen when asked about his definition of leadership. And I believe that reconciling opportunities and challenges with competency is really the bottom line for an effective workforce. Next. So we have a lot of good background and papers that are out there, but we need to ask the question every parent dreads. Are we there yet? How are we doing in our One Health workforce and in activities? So there's several colleagues who've done a lot of work in this area, and I'd like to acknowledge and compliment them. Dr. Eri Tugami had a paper and another one coming out on core competencies. USAID Respond Team from University of Minnesota and Tufts and Workforce Project, and the most recent work being done by UC Davis and their collaborators in the Next Generation Workforce. People that are listening to this, they can refer to those papers, and they're really well done. In the Tugami paper, she talked about looking at 45 academic degree granting programs just in the United States. The majority of these have really been created in the last 6 to 8 years. As we move forward, I believe there's a lot more advances and even more robust advances outside of the United States. Substantial progress in defining the workforce, and we talked about the work USAID folks have done, but also CDC, WHO, the One Health offices that we see across agencies, and OIE, who put together day one competencies. So these are other areas to look at as we learn more about competencies and developing them. There's certainly an increase in the number of scientific papers on One Health and workforce, increase in the number of meetings that I just checked. I think yesterday I found 50 websites just in the United States that talk to various aspects of One Health, more one-line offerings, increase in assessments and actually measuring results, joint external teams and PVS and OIE. So interests have been building. We're really pleased that the social sciences are also engaged and have been, I think, new members and very active in One Health. Next slide. So I think one of the things we need to remember is that the idea of competencies and skills are not interchangeable terms. Competency is an observable capability that integrates knowledge, skills, values, and attitudes. It is the how, if you will, things are effectively performed. There are core competencies, sub and advanced competencies, and we see competencies on a continuum from beginning to proficiency. Skill, on the other hand, is a specific ability when applied to a specific setting that leads to accomplishing predetermined results. It is, in essence, the what and may lead to proficiencies. Skills are often categorized as technical and soft or interpersonal. We're investigating and working much more on milestones of competency, how to operationalize them better, and how to measure them better. So as students develop these competencies, we're learning how to measure them across their professional curriculum, whether they're novice, beginners, competent, or proficient. And that change in evaluation of competencies have been very helpful. Next. So if we were going to take a look then at both knowledge and skills, there's a lot of good references. This is just a word cloud that I've put together that is taken from an in-depth analysis and evaluations from a list of past papers. And this is kind of a meta-analysis. So if I'd say, what are the key knowledge areas for One Health workforce, they'd be epidemiology, risk assessment, ecology of disease, preventive medicine, infection prevention, zoonoses and emerging infections, environmental health, health determinants, wildlife and conservation medicine, informatics, public health, surveillance, understanding outbreaks and spillovers, global health, and understanding the dynamics at the interface of the One Health domains. Next. The same thing then and examined a number of papers and background materials on existing references. This is a word cloud that kind of where different skills have emerged and I think where a common consensus has been found. So the first four, I think, are really core competencies that I see almost in all kinds of skill sets needed in a competent One Health workforce. Communications, to be able to form and work in teams, systems thinking, and the ability to work in collaborative teams and groups. So those are the four that I see have emerged to the top in all of the critical skills. And there are working across boundaries, leadership at all levels, situation analysis, risk assessment, risk analysis, analytical capabilities, especially with large data sets, interpersonal skills and emotional IQ, cultural awareness, conflict resolution, and four that have emerged, if you were going to ask employers the skills that they were particularly wanted in a One Health workforce, they would include problem solving, project management, where a One Health worker could actually design a field study or research study and take it to conclusion, stakeholder engagement, and the ability to lead and manage change. Next. So the big changes that are taking place in education right now are really a change in competency-based curriculum. It is a revolution that I've seen in medicine and certainly taking place in veterinary medicine right now. And the difference is from the past where we started with a curriculum and then kind of had experts develop that curriculum and then retrofit that into kind of needs. This is all being changed now in terms of competency curriculum. We now need to start with needs of society and with health systems. We need to map backwards and understand what are the critical competencies that will meet those needs, society needs. From the competencies, then we develop a curriculum. And at that point of curriculum, we talk about the best way to impart knowledge and skills as we move forward. So this is very different. So it means that we start with what's happening in an environmental analysis and what's happening as we move forward into our communities. So we know what those needs are and the environment that we work in, a time of globalization, of speed, of connectivity. Unfortunately, One Health is a holistic, integrated approach. And we often try to retrofit these into vertically oriented, siloed systems where they don't fit very well. We need to train that workforce needs to be part of the right environment. And from the Army War College, they have now adopted the idea of an environment being volatile, uncertain, complex, ambiguous, as they kind of redesign strategies in warfare and the new fighter, if you will, of the future. These are the same kinds of uncertainties and issues we deal in One Health and trying to get competent workers. Wicked problems are those where old interventions don't work, old solutions don't work so well, and new ones are just now being adopted. So we live in this world of rapidly changing economic, trade, health, immigration, all kinds of complexities where no one seems to be in charge, yet this complex work still remains. So how do you prepare a workforce? What are the competencies necessary to do well in this environment? And one of the things we see is this shift from being independent, which has been common in a large number of medical sciences, to then being more changed in terms of interconnected. The interconnectedness is where we connect along a continuum and where most of our threats and risks come from, to the critical strategy of a One Health workforce, and that's being interdependent. And interdependent means we're mutually dependent and reliant on one another. And that's the true issue, I think, of moving forward. Next. So our ability in educational systems to understand the right knowledge, to understand the right skills, to build these competencies, we need to look at how do we actually impart these. So pedagogy is really the method and the practice of teaching. It is how knowledge and skills are imparted to learners. So we know, I think, in the One Health workforce, this isn't about just under the format of one lecture right after another. So these are settings, I think, in pedagogy that are really important. Intertransdisciplinary teams and settings, working experientially. We've seen this in summer institutes in global health. Case studies where you're actually working on stories that are relevant, whether that's antimicrobial resistance or emerging infections. Creating and nurturing a collaborative network, and I think our next speaker will talk about that. Twinning programs where you actually engage long-term faculty, staff, and students in an immersion type of a system. And the competency-based learner set system that's now being put in place and substituting the old way of learning. And I'd like to make a special pitch for the working together with interprofessional education and practice, IPEs. And I think we have a real possibility of increasing capacity by using this pedagogy. So if you look at interprofessional education, it's probably existed for half a century, but substantial increase in growth in the last decades, where 16 to 20 different health science groups are put together as part of a national strategy to learn and develop together as they actually improve health outcomes in populations and individuals. There's 140 national centers that are connected with learning with health sciences this way, are translating this into practice teams, and they have very similar core competencies and goals defined in One Health. For some reason, we are going and working parallel with this pedagogy. We really need to combine forces, could actually improve capacity in both areas mutually, and areas that we really need to look at strategically. Next. So looking at a gap of where we are today, and as we kind of move ahead, and I know tomorrow's session is more looking into the future, but some of the critical issues are scalability. You know, how do we substantially enlarge this workforce? Besides being competent, how do we enlarge it? I think it's really important that we think about doing that and doing it faster than what we've done. Expanding training and education across our life sciences. Strongly embedding a workforce and concept, we talked earlier about this, into a national security agenda and efforts addressing health equity. By doing so, we open up new possibilities, new understandings of One Health, new partners, and I believe new resources that could come in. So a very strategic group that we need to stay involved with and to think about as we develop our workforce. imparting key competencies and especially knowledge into non-One Health workforce so they have a better understanding of what One Health workforce is and how they might use them. Just talked about a more effective pedagogy and different options that we have. Focused on shifting from knowledge to applications. It's not just what you know and your competency, but how well you can actually move that forward and apply it. Expanding One Health understanding and utility across other professions, employers, and the public. I'll say a little bit more about that in the future. And to be able to identify and impart new and relevant competencies or some competencies as this workforce develops and are able to meet the challenges of the future. Next. So a group out of California called the Institute for the Future has put together some strategies and skills that they see are going to be necessary for the future workforce. I think they very much fit into the One Health workforce. And they suggest that 35% of the skills that we have today will change over the next 5 years. So it's just the idea that if this premise is true, that means key skills needed for One Health workforce continue to change as well. Especially, I think, the exploitation of the power of information technology for learning and applying this technology to programs and applications. Mastering large and disparate flows of data and search for new insights and problem solving. The Institute of the Future talked about driving forces. Those are the areas underlined. And then these sub-competencies that they believe are bubbling up that are going to be necessary for the workforce as we move into the future. And I think this is absolutely true, especially as we become more proficient in the One Health workplace. And that's looking at creating new insights, responding to the unexpected, persuasive communication strategies and new media, design thinking, translating large databases into new concepts, discriminating, and be able to filter information that's necessary from just noise in the system. And then the idea of T-shaped workers. And a T-shaped worker would be a One Health worker with a deep understanding or proficiency in one area, but be able to have the capacity then to understand the broad range of disciplines and how those fit together. Next. So one of my favorite cartoons that I've seen is this gentleman talking to his cat, and he says, never, never think outside the box. And this is actually the opposite of what we need in a workforce. Not only do we need to think outside the box, but a recent textbook that I've liked by Rosabeth Mox-Cantor, it's called Think Outside the Building. This is an appropriate metaphor for taking the complex, messy, intractable problems when there seems to be no single organization or group in charge, and putting together innovative ideas and strategies, powerful guiding coalitions, and systems thinking into brand new strategies as we actually move and outside the confines of our own building. So we know that One Health is the ability to put together professions and disciplines and ideas. But lots of times, if we are stuck in the confines of our own professions, our own institutions and organizations, we can't do this very well. So the idea of thinking outside the building is a key strategy then to build big solutions for big problems as we move forward. And one of the things that she's also said that I believe is important is the idea of innovation. And for low and middle income countries, the idea of training, learning, innovation may be their key, I think, to real breakthroughs. Next. So de-siloing. So I don't think we can break into some of the cultures, but we can use One Health and holistic dialogues of working outside the building, if you will, building tunnels, building tightrope walkers. Anyway, enhancing collaborative, non-hierarchical relationships into effective teams. We're doing that, and effective workforces continue to do that. Next. So where are we today? Well, I think it was Rahm Emanuel once said, never waste a good crisis. And here we are looking at a $14 trillion global event that may end up being much more, that really requires all new thinking. And with these kinds of crises, I think we need to understand that we can actually be able to do things not previously possible. So this is not a time for fundamental incremental thinking. It's a time for transformative thinking and preparing a workforce into the future that's able to come to grips with very aggressive kinds of actions. It was the World Bank a few years ago that said between $2 and $3.5 billion per year could be invested in low and middle income countries into their infrastructure and really do a lot in addressing zoonotic diseases, especially in this One Health workforce. That seems to be a real bargain today when we think of the trillions of dollars. Building the workforce tomorrow and not looking backwards. I like the Harvard leadership of meta leadership, where they stress the idea of being able to lead across organizations where you don't have authority. And in the business community, the number one skill seems to be relationship building. It's the skill for the decade. It's absolutely pertinent to building within the One Health community and for One Health workers between the health sciences, and especially a new relationship with understanding and working with our natural systems. Next. So these last couple slides then are just then to move to the last part of this conversation. And that is to say, well, what are the recommendations and actions that we can do today that will really make a difference tomorrow? And I would say there's 4: reforming and transforming education, new relationship building, to be able to upskill or change our skill sets to meet new needs, and building capacity. So in reform and transformation, we talked about competency-based curriculum, which being worked on, which absolutely is critical as we move forward. Perhaps looking at more global certificate programs online that we can build up capacity, adjusting standards and accreditation that's being done in IPE or interprofessional education, embedding One Health curriculum and better pedagogical options. We've talked about that. Better public awareness of what we're doing. And then in terms of relationship building, IPE, I think, is a real missing link that could really be positive. Working and building collaborative networks, the idea that there's other strategies being put forward in planetary health and convergent science, and we need to come together and understand that these are very similar in terms of needs, in terms of competencies, and what we don't need to do is to build more silos. We need to bring ourselves together in these strategies into a coherent future strategy in the workforce going forward. Using AMR as a fulcrum to move forward, linking with health systems, sustaining and protecting our natural systems. Next. So upskilling, as we talked about, how do you lead across organizations and agencies where you don't have authority? There's cultural awareness and building teams with a lot of different ideas and backgrounds. The key need for innovation, implementation strategies and project management. Leadership can't be overemphasized. Countering our VUCA worlds, these T-shaped experts as part of our upskilling. Capacity. So I think it's a real problem when we just think about a One Health workforce. It doesn't mean a lot to a lot of people. It doesn't mean a lot to a lot of employers. So what about new positions that would say, these are proficient One Health workers to actually focus on the following: a national preparedness and response officer, a specialist in reducing risks at the human-animal environmental interface, resilient resource experts, pandemic prevention officers. We can do these things and have them with a real meaning and with real specificity to the needs today, and I think advance the One Health much further with employers. The need for agriculture as the critical part of expanding, and I can't overemphasize the next group of One Health workers in the workforce has to be agriculture. And it's about crops, it's about infectious diseases in animals, and how those infectious diseases in the One Health workforce competencies are very much the same. Agriculture has to be the next extension of One Health, including plants and animal infectious diseases. And why not build a couple centers of foresight, prediction, and preparation, and do that right now. Final slide. So one of the greater barriers, I think, as you're thinking about systemizing One Health is make sure that if systemizing is really the right thing to do. Trying to reconcile technological changes, economic and global integration, and emerging health threats with traditional political structures, institutional arrangements, and habitual ways of doing things is perhaps our greatest challenge. So we don't want to systemize into a system that is not receptive to One Health. So in designing and preparing the One Health workforce, we cannot forget about preparing and enabling a knowledgeable One Health workplace. So Dr. Harris, I'm going to stop there to make sure Dr. Smith has plenty of time.